Hello, my name is Dr. Brandon Wuzzardo. I'm an optometrist at South Jersey Eye Associates in Bridgeton, New Jersey. I went to school at Pennsylvania College of Optometry, which is now Salem University. And after school, I came home, which is where I grew up in Bridgeton, and actually took over for the local optometrist. Just as our bodies start to slow down as we age, so do our eyes. We can't jump as high as we used to, run as fast as we used to, and we get fatigued a little more easily, and that also happens to our eyes as we get older. So there's a few things that you may notice. The first thing, and usually the most important thing that comes to mind, is your lack of ability to focus up close. And that's actually, it has a name, it's called presbyopia, and that actually happens to everybody that reaches that age. Once about 40 to 45 is when it starts to kind of creep in, and it's actually a muscle in the eye that starts to lose the ability to focus up close and contract and restrict. And as we get older, that ability to focus gets worse. And you might notice that you start moving your reading material further away until your arm isn't long enough anymore. And that's actually due to, again, the muscle inside the eye not working as well. Another thing you may notice is your central vision starts to go a little bit, and that's actually due to, again, the muscle inside the eye not working as well. Another thing you may notice is your central vision starts to go a little bit, and typically we don't see that till about 65 or so, but that could be due to macular degeneration. Macular degeneration is a disease of the eye that causes what we call scotomas, or areas in your vision that are not as easy to see as they used to be. Age is a definite risk factor for that. Another thing you might notice is you need more light in order to see. Most of the time it's reading material. A lot of patients will come in and they'll say, "Hey doc, I'm noticing I need to use more light on my reading material to really see it well." And that happens for a couple different reasons. The first is that we lose pigment in our eyes as we get older, and pigment is actually what's absorbing the light. So you can imagine if we lose that, we're not absorbing as much light, and therefore we need more light to kind of compensate for that loss. The second part of that is actually cataract formation. So a lot of people have heard of cataracts, and we all think of the elderly population when we hear that word. But it actually starts right around 40 or so, and it's minimal at that point, but it gets worse and worse and worse as time goes on. And that actually doesn't allow the light even to get to the retina. Instead, it scatters it, and that's what makes you light sensitive. And when you're driving down the road and headlights are coming at you and you really are having trouble seeing, that's what's taking place. That light is scattering, and that's what causes the detriment to your vision. Another thing you may notice as we get older, our eyes get drier. And all of this sort of ties in because, again, dryness can scatter light. So dryness changes your vision, it changes your clarity. Your eyes are getting drier, your vision's unstable. You may notice a sandy, gritty feeling in the eyes, or a lot of patients come in and they'll say, "Doc, I feel like I have something in there." Most of the time there's nothing there, it's just the dry patches that are causing that. So there's a few things you can do. Staying healthy, trying to keep your body as healthy as possible. Diet is a huge thing. There's been a lot of studies that show that eating a lot of green leafy vegetables, so that actually will help kind of defend some of these things that could happen: cataracts, macular degeneration. And there are some genetic parts to that too, so we can't help those things, but if we maintain a healthy lifestyle starting with diet, that can make a big difference. Smoking is actually the biggest risk factor for some of those things. Smoking has been known to cause cataract formation faster, macular degeneration, even dry eyes. So all of those things I talked about can be affected by smoking. So just like it's harmful to the rest of your body, it really plays a big role on the eyes themselves. I actually didn't get an eye exam until I went to optometry school, and I've learned now that that's not the right thing to do. So I still see patients that have never had an eye exam. They come in and they're 50, 55, and it's their first eye exam. So I make sure that I explain to every patient, even parents that have maybe little kids at home, really, when they start school, you really should start getting an annual eye exam. And there are some patients that aren't going to have any issues, and I was one of them, and that's why I didn't know that I needed to go to the eye doctor every year. But it is really important, not only for the visual part of it, but also for the health part of the eye. Optometry has really changed over the years. It used to be, go to your optometrist and get your glasses or contacts and then go home. But now it's not. It's that plus all the medical side of it. So it's really kind of changed as time's gone on. It's very much involved at this point. But a yearly exam is really when you should be going to your eye doctor to make sure these things aren't happening. And if they are, this is what you do to kind of prevent it from getting worse, or at least slow it down. There's a lot of times where you feel like something gets in your eye and then, in the next 10 minutes it goes away. But if it's something that's persistent, say it's an all-day thing, with that, in that regard, that's the time where you would say, okay, I think I need to get this checked out. Vision changes are a little more important in a lot of cases, because say your vision blacks out even for 5 seconds. That's not really normal. So that could be, something that might be a systemic problem, but it's just manifesting itself in the eye. So a lot of patients we see come in, they don't think anything's going on, systemically, but we see something in their retina or in their, the front surface of their eye, and we say, this could be more of a bigger issue than just your eye problem. It could be a systemic problem. So things like stroke, cancers, diabetes, high blood pressure, all of that a lot of times can be diagnosed from just looking at the eye.